Now for the next group of drugs, which we'll try to look at the introduction to its pharmacology, we'll look at the introduction to anti-helmintic drugs and drugs that act against ectoparasites, anti-helmintic drugs, and drugs that act against ectoparasite. Of course, helminths, you know helminths, right? All these trematodes, cestodes, nematodes, acanthocephala, all those, worms. All right. So these ones are drugs that basically act against them. The ectoparasite could also include other ones. Okay. So these ones are mainly parasite that are like endoparasites. You understand? That's the difference. So anti-helmintic drugs are the first ones we'll look at. When we are done, we'll look at the ones against ectoparasites. So for the anti-helmintic drugs, we said that these ones are just drugs mainly used in treating what? Infections caused by parasitic worms. Okay, so they act by paralyzing, killing, or inhibiting the metabolism of the worms. They basically make it that things are not going on properly for the worm. Okay, so drugs for nematodes, that's roundworms. This is nematodes, they are the first ones we are looking at. So nematodes, we have drugs like the Albendazole, the Mebendazole. This is Albendazole. Okay, we have other drugs like Pyrantel, pamoate. So these ones, they inhibit microtubule synthesis, so they'll make it that the worm is not moving again, just static in one place. This one's a depolarized neuromuscular block, so they'll block the connection between one neuron and another one. Then Ivermectin enhances inhibitory neurotransmission, so it also paralyzes worms. Then Levamisole, okay, also paralysis for the worms. So drugs for trematodes now. Okay, wait. The first one was nematodes. Sorry, the first one was this, roundworms. Trematodes is this one. Okay. So trematodes, we have drugs like the praziquantel. This is praziquantel. Praziquantel will increase calcium permeability. So too much calcium will be going to the muscles, or sorry, the structures of the worms, that will make it actually paralyze. Then we have the Benzimidazoles. Okay. Then next, we have drugs for cestodes. So drugs like what? The niclosamide. We have the Albendazole too. Okay, Albendazole can also be effective against this. Okay. Then we have agents against ectoparasites. So ectoparasites, we said that these ones will target parasites that live outside on the skin or hair, like lice, like the mites, like the ticks, like the fleas. Do you understand? So we have drugs like the permethrin 1%. This is permethrin 5% though. Okay. We have the malathion 0.5%. Okay, this is Ivermectin. Okay, then we also have the Ivermectin. Alright, so this is Ivermectin. Okay, so scabicides. Okay, these ones are basically for what? Pedunculicides. That's basically lice. Okay, then we have the scabicides like the permethrin 5% cream. We have the Ivermectin. Then we have the benzoate lotion. Okay. Then other ectoparasite agents, we have things like the lidane, we have the sulfur ointment, okay, safe for infants and all of that. So this is what we got for these groups of drugs. Just an introduction. We'll come back later and talk about the pharmacology of each drugs.